r/AskReddit by Reddition. Like and subscribe. Medical professionals, what is the stupidest misconception a patient has had about the human body? I still remember reading a Reddit comment from a doctor years ago that they were telling the person they were about to lose a finger. They said the person seemed way too okay with it, so the doctor asked how they were handling it so well, and the person genuinely told them that it won't be too bad because at least fingers grow back. It began a whole slew of comments from other doctors with patients who had the same misconceptions about limb amputations. Oh ha ha ha. Yes. Of course I know that human limbs don't regenerate because I'm a real human. I was just making a joke. I had a father of a baby absolutely beside himself because his newborn baby had no teeth. They seem to think that by pausing a seizure to inform us that they're having a seizure, they'll get benzodiazepines. Lol no. How are you feeling today? Not great. I have a cough that starts from an emotion in my throat and chest. That emotion disturbs me. A bacterial pneumonia. Roommate is a neighborhood spiritual guru. Not a medical professional, but a biology teacher. Anyone who has seen a picture of the pituitary gland may understand why I had a student who thought the testicles were in the brain. There are a few times a year where a teacher may have to try and hide their incredulous astonishment at student misconceptions, and I'm ashamed to say I didn't manage it that time. Did you have anything this morning for your fasting blood draw? No, just tea with honey and a glass of orange juice. I ate a brick of Velveeta cheese this morning and I'm having abdominal pain. If I massage my prostate using my wife's dildo, it makes it easier for me to pee. My mother, a doctor, volunteered to give a health lecture to high school girls in the South, Arkansas to be precise. During the cap period, when she asked if anyone had questions, a girl asked her if it was true that lemon juice was a good contraceptive option. She didn't understand, so the girl explained that after her boyfriend came inside of her, she would squeeze lemon juice into her vagina to prevent pregnancy from occurring. I wasn't there, but can only imagine the look on my mother's face based on the way she reacted to my idiocy throughout my childhood. What do you mean, I can't eat an entire fruitcake? Isn't fruit supposed to be healthy? Diabetic type 2 with a blood sugar level of 450 mg per deciliter. I had to explain to a pregnant woman once that the baby is coming out of her vagina. She was almost 6 months pregnant and was horrified. I think she thought all babies were just C-sectioned out. I overheard a guy talking to another at a pregnancy clinic. I just don't get it. She was standing up, the sperm would have just come out, how is she pregnant? And both of them seemed very confused. One person didn't think the stroke they were having was a big deal because they could get some brain transplanted from donors, right? I couldn't even. There's so many. A lot of people on medication and they have no idea what they are taking it for. Oh, do you have any health conditions? No. 10 minutes later I re-ask, no conditions? No diabetes? Or high blood pressure? Oh yes, I have those. Just, oh lord. My pre-med college roommate thought penises retracted inside the abdomen. My favorite teenage patient was asking about birth control and thought you could just wear the NuvaRing on your wrist instead of having to insert it in your vagina. Thankfully we got her on something else. There was this really sheltered guy I knew who used to ask, which would you rather have, balls that were the size of baseballs or softballs, and we thought it was some weird hypothetical. Turned out no, he had one the size of each. Obviously, dude had some serious medical issues going on. But when we found out, I can only imagine the conversation that guy ended up having with the doctor. I'm a dentist and the thing we get all the time that I hate is parents not caring about their child's decay because they are just baby teeth. Losing baby teeth early causes all sorts of problems aside from the pain and trauma, but in addition to that I often have to explain to parents that the adult teeth that erupt at age 6 are meant to last forever. They're always oblivious. Not the dumbest, but most recent. I had a patient who needed a tooth extracted. Young teenage girl, obviously very sheltered. She was telling me how bad it hurts, and I asked her what she takes for pain. I apply a little clove oil to it when it keeps me up at night. I asked if that works, and she goes not really. When I told patient and mom to control post-operative pain with ibuprofen and acetaminophen, they looked at me like I had grown a second head. I offered a diabetic a tissue after doing a finger prick to mop the 2 drops of blood on his finger. He looked at me like I was an absolute idiot, said you don't know very much do you, and sucked the blood off his finger. Then spent the next 5 minutes educating me that, because he was a diabetic, he needed all the blood he had. Therefore he needed to put it back into his body rather than wasting it by putting it on a tissue. He was under the impression that if he just drank his blood it would go straight back into circulation. My mother asked me once, completely serious, why brain transplants were not possible. She didn't understand why, if you had an inoperable brain tumor they couldn't just pop a new one in there, like it was a heart all over. I tried to explain to her that it wouldn't be the same person, but she just stared at me blankly. I love my mother, but that was probably one of the stupidest conversations I've ever had. Previous medic here. But I don't have any sugar in my house. I'm type 1 and trying to lose weight on the keto diet. I'm drinking only water and not eating for 30 days to detox my liver and kidneys, said the perfectly healthy 25-year-old. Also a medic. Oh, my daughter has croup. So I just sliced up some onions and put them in her socks for her to wear to bed. Oh yeah, that'll do it. Angry son of a COPD patient, set my mom's oxygen higher. If you set it higher she won't have COPD. I had to explain to a patient's dad that his son's heart was at risk due to fluid inside the pericardial sac. We call it a pericardial tamponade. That man flat out refused to believe that human hearts have a membrane around them because he had dissected a sheep heart in high school and never saw no sac. I once administered a certain type of breathing test to a 58-year-old female patient who worked at a manufacturing plant on 8-hour shifts. In self-reporting her smoking history, she told me she smoked up to 8 packs of cigarettes a day. I think her misconception was that she was going to live forever. I'm a veterinarian and I can't tell you how many nipples I have diagnosed. PS sorry that's not a human body, but thought it was fun to share. I've had a few good ones, but the funniest actually happened during my first year of college studying PT. Someone raised their hand in anatomy and physiology early on in learning about muscles, their attachments, actions, and innovations. She asked why humans don't have meat like cows, pigs, and other edible animals. The professor stalled for a second holding it together, then asked if anyone else was wondering about this. Roughly a third of the class, perhaps 20 people, raised their hands. She spent the next few minutes explaining/convincing people that muscles are in fact the meat. It was hilarious. Edit. Also, I asked her after class. She said it actually wasn't the first time she'd been asked that question. Not me but my sister, currently in residency. She was with a patient who had a severe pain in her thigh. They screened her, ran thousands of tests and nothing came out of it. They later found out she had a bullet in her arm, but that it had hit her from behind, so it couldn't be seen when she laid down on her back. She thought her thigh was in her arm. I seriously do not get how they didn't find it, since this is more common in ER situations, but I guess mistakes slip through sometimes. Edit. I don't understand either why the lady didn't point out the fact that they were checking her leg instead of her arm. But she was supposedly very problematic in general, and I just feel gratitude to the healthcare workers who have to be nice to people that behave like assholes. I had breast reduction surgery. My husband went to the pre-op appointment with me. The doctor was explaining the surgery and mentioned they would remove my nipples. My husband asked where they were going to get new ones from. 12 years later, and we joke about wondering where the nipple locker is. I'm in the mental health field, but I met with a client who was worried that if their relative had a heart transplant, would the relative still love and remember them? The logic being that the feeling of love lives in the heart. I'm training to be a midwife and once met an expectant father who panicked when he heard that his daughter was breech because he thought this meant that she was going to come out of his wife's ass. Actually took a chunk out of the inside of my cheek trying not to laugh. I was getting dressed for a hunt with my EMT friend and he goes, "Dude, you've got a hernia." I was like, "No, I'm just growing an outie." He then proceeded to tell me how dumb I am. A few months later I had hernia surgery. Sexually active means the level of activity during sex. Working in an ER as a nurse practitioner. I had a patient's granddaughter, who was pregnant, ask me if she dyed her hair would it also dye her baby's hair. Made my day. That the human anus was made to take a hot sauce bottle. Spoiler alert, it's not. My dad doesn't have a clue on anything that happens in the body. I told him I work in a tissue lab and he asked, "Oh, are you developing new Kleenex?" When I told him that I work with body tissue, this man really said, "Oh, I don't think I have that. I just use Kleenex." I had a colleague in her 30s with children who had come to the UK after marriage. She asked me one day if you could use tampons before you were married. She honestly had no clue about her own anatomy. Have you had any surgeries? Nope. Does court scan and sees gallbladder is missing? Did you have your gallbladder removed? Oh yeah, but that was so long ago. It doesn't grow back. A couple was pregnant and didn't understand why, since they were taking the birth control pill. It turns out it was the guy who was taking it. Holistic doctors have convinced a lot of people that adding bleach to their drinking water will cure chronic diseases. Literally a high enough dosage to stain clothing being drank through a straw. Best part is there's no convincing them otherwise. In my EMT class, the instructor asked us why women are more likely to have UTIs. One of my female classmates offered up dirty fingers as her answer. I'm an X-ray tech working in a mammography clinic. Had a young woman come up to the desk and ask if she could ride home in the same car with her mom, who just had a mammogram and might still be radioactive. I work at a pathology lab that takes COVID tests. We occasionally get phone calls like, "Where's the nearest testing site?" or "What's the wait time at testing site name?" All reasonable, except for, "Does it hurt when the swab touches your brain?" I'm guessing she had a friend or family member get a test and described it to her, but it was pretty hard not to laugh. I did explain to her what actually happens, and she seemed relieved, but it still makes me giggle to remember. I asked an elderly patient to show me how she gives her insulin. She said, "I need an orange." I said, "Why?" She said, "Well, I draw up my insulin in the syringe, inject it in the orange and eat it." That's how the doctor showed me to do insulin. Reminds me of Patrick Stewart's confession that he didn't know he was uncircumcised till he was in his 60s. Confessions of Patrick Stewart, uncut. Not my patients, but from a nurse I knew back in the days. A man and a woman with some kind of developmental issues were trying to have a baby, but intercourse wasn't working, so they consulted. Turned out the man was trying to insert his pee into the woman's belly button instead of her vagina. Apparently, the woman's belly button was full of bruises. I'm a phlebotomist. I've had so many patients tell me blood is blue until it touches air. My girlfriend told me a story about an elderly patient they had dying of COVID who was telling them up until he was intubated that he wasn't dying from COVID because it wasn't real. Convinced they were wrong and it had to be something else. Thank you for watching. Like and subscribe for daily Reddit videos.